Now, on Monday, after the arrival of the first 1 million doses of the covishield vaccine, the President explained the rollout of these drugs would be a group effort involving not just government, but the private sector and non-governmental organisations as well. Gift of the Givers has been doing great work during the pandemic, specifically helping to upgrade government hospitals so they can better deal with the challenges of COVID-19 admissions. And yet it seems they have not been included as a social partner in the vaccine rollout. Let's discuss this now with the Director of Gift of the Givers, Dr. Suleiman. Good evening, Dr. Suleiman. So what is your understanding of the working together plan as outlined by the President on Monday, and actually just reiterated this afternoon by the Deputy President? What is this plan, and did you expect that as a prominent health NGO you'd be on board?
Good evening, Sally. No, we haven't been called. We're not privy to the plan. We don't know what the plan is. You know, at the beginning, when the government started out, it was very, very clear that they were going to do the process themselves. Private sector got involved, medical aids got involved, and all said they want to play a role. Now, what is surprising is, we don't expect, we know our role, we know our capacity, but we're never presumptuous. If government wants to call us, well and good, they can call us. They know our capacity, they know our capability. But, we're not going to look forward to that. But if we call, yes, we can help. What has been very, very amazing is that in the last 2 to 3 weeks, look, let me say at the outset, we were not keen to get involved in the vaccine rollout at all because government made it clear they're going to buy it themselves, they're going to do it themselves. So that's fine, it's their right to do that. But in the last 2 to 3 weeks, we've been flooded with calls from corporate companies, medical aid societies, private sector, the public, medical fraternity, hospitals, doctors, all saying, why don't you guys get involved? And I just used one line. I said, look, how do you get involved? You can't purchase the vaccines. The government is going to buy the vaccines. They've got a system. They want to roll it out. So how do you interfere in the process? How do you get involved? Unless they call you to say, we need this, that, and the other. That's the first thing.
I'm just going to stop you there. And I'm going to stop you there because we've now heard on 2 occasions from the President on Monday, and the Deputy President issued a statement that they are planning to work with civil society and NGOs. So it seems, according to what they're saying, at any rate, that there is a plan to involve surely organisations such as yourselves. I mean, is that your understanding of the messages coming through from government?
Yes, well, I mean, if they say NGO, it may not be us, but it could be NGOs. It doesn't matter. But the reality is they can't do it alone. They need partners. And I would explain that a little further. Companies called us and said, I mean, amazing things. We have the biggest cold storage facility in South Africa. We can give that to you free of charge. We have cold storage trucks to carry the vaccines throughout the country. We can give that to you free of charge. Medical aids came and said, we have more than 3,000 to 4,000 nurses. We can use them to administer the vaccine. And more than that, I got buy-in from companies to say, we can give you fridges with generators to help the hospitals. Then I said, but okay, what about those poor people? Government said it's going to be free for everyone. Can you give something to the party? Bring something from the CSI budget. They said, look, we can vaccinate all our members, all our staff. And for every one staff we vaccinate, we will give one vaccine. So it's that kind of issue. But something else happened 3 days ago. I got a call from the Department of Health. And they said, we heard you're procuring vaccines. So I said, we're not procuring vaccines. You guys said you're doing it yourself. They said, but if you're procuring vaccines, we want to partner you. And we have started the process, speaking to people in different parts of the world to see, and this is where we can help government. As an international NGO, we can try to leverage companies to get vaccines as an NGO outside government to increase the number of ampules we can get faster into the country. There's no guarantee, but we can use our reputation and we can use our connections maybe to do that if government is willing to do that, as they said.
All right. So has the health department said, yes, please do go ahead if you can procure more vaccines?
They said yes, but then I told them, I need that in writing. But I can't get that in writing. But they said, look, if you get the vaccines, we're there to partner you and work with you. And either way, we've started the process already. We're speaking to people in different parts of the world because there's a shortfall. It's an admission that whilst it's been announced that 40 million vaccines are being procured, there's no guarantee at what speed that's going to come in. And remember, to get that immunity, that herd immunity, you need to vaccinate everybody in a certain period of time. And you're talking about 40 million people. And if those vaccines don't come in time, what happens?
Yeah, and you know, you're raising such important issues, and it's clear that you're already starting to mobilise. You're not waiting for government. You're going, right, what can we do to help? Because there is so much that needs thinking about, as you make the point that we need cold storage. We need cold storage on the move to move these vaccines at specific temperatures. We need fridges that will work whether there's a power blackout or not, or if there's no electricity. How do we do that? And those are the little details that could absolutely provide a stumbling block and mean that vaccines, when they get here, could be wasted. What is your next step? Are you going to just start mobilising as you are and wait for government to say, yes, please help us? Is that how it's going to work?
We're not mobilising. We're getting mobilised. We're getting pressure from everyone, from doctors, from companies, everyone. I mean, they've come to us and said, look, we'll put money down. And Sally, it's such a simple process. Government was saying they don't want to be a rip-off in terms of pricing. But yet nobody's selling the vaccine to anybody in the country. They're buying it and giving it for free to their members in the companies. So there's nobody making a profit here. If all the companies, the mines came to me. They said, you know how many mining doctors and nurses we have? We can vaccinate all our staff and do the double vaccine, the first one and the second one. And from our budgets, we can provide several million rand to pay for vaccines for somebody else. But they all said one thing: we only trust you with the money, unfortunately. And they said, look, we will give you the money, not mining specifically, but all the companies. We will give you the money if you can get these vaccines.
So, Dr. Suleiman, I have to ask you a direct question. How confident are you that the government is not only going to get the vaccines rolled out to everyone safely and under the right conditions, but also that it's going to be able to maintain it? Because we've got a million doses now. We've got another 3 million coming soon. You know, we're hearing from government today that they've started the electronic process of people being able to register. But remember, that happened with the UIF. People were able to put in their details. They set that up quite quickly. But it's the follow-through on that. So how confident are you that government has got this?
Look, Sally, it's good to start with 1 million, not good to start with 10 million. But 1 million, that's, you know, you start with something small. It's relatively small compared to 60 million. You've got all the frontline healthcare workers, which are, I've seen the chats, they're all enrolling into the program, all keen to get the vaccine. So yes, with the first million, they can try out all the processes, see if the vaccines hold, if the fridges work, there's no load shedding, and they can reach 1 million people, because most of them are in the hospitals, early public and private hospitals. So that may work. My biggest fear is there's two fears. One is, will we get the balance of the vaccines? And to be honest, I don't think so. I don't think we were going to get it quickly enough. You can see already in Europe, they're scrambling not for the vaccine to go out anywhere else. They're slow with the process. They need to keep the vaccine. The production by the companies that have promised production at a certain rate is not happening. So there's low production, increased uptake in northern countries. So I think we're going to get left out. And that's why we say use NGO status to bring that in. And then, of course, the other very, very big question, where everybody's sort of skirting away. We all will be vaccinated, but will we all be immunized? That is the question. Are those vaccines going to work against the strain that we have? And everybody's saying different kinds of things. And what happens? Are you so confident? Okay, I've taken this vaccine. Now if I get sick, I can go in front of my wife and my child and nothing will happen to them and nothing will happen to my patients. Can we honestly say, yes, that's not going to happen?
Thank you so much for talking to us this evening. Gift of the Givers Director, Dr. Imtiaz Suleiman. Now,